What's going on, everyone? Welcome to today's pandemic update for Friday, April 28th, 2023. Kind of a slow news day, but there are some things to report on that you need to be aware of. First off, India, 7,533 new COVID cases in the last 24 hours. They've also added 44 more deaths. While cases are down from yesterday, deaths are up. And we'll have to see if cases continue to decline next week. If they do, I'll be ready to say that yes, India has peaked. But for right now, I'm not seeing just a rapid drop. I'm seeing just an ever so slight drop because remember, yesterday and the day before were slightly elevated again compared to earlier in the week. Deaths, as you all know, deaths are the last lagging indicator, and deaths usually cases first, then hospitalization, then ICU, then come deaths. So we do expect to see at least some sort of an increase in deaths in India over the next couple of weeks. Taking a look at this. This is from CBS News. CDC eases COVID vaccination rule on international travelers as expiration looms. And what they mean by that is the expiration of the pandemic emergency. And yes, let's read this first paragraph here. The Centers for Disease Control and Prevention moved Thursday to formally loosen its COVID-19 vaccination requirement on foreign visitors, which will now allow some to board flights into the U.S. with only a single dose of COVID-19 vaccine from Pfizer or Moderna. Should this be a surprise? No. Why should it not be a surprise? Because it's really a sign of the times. We're starting to see everything loosen. Probably by the end of summer, I don't think there's going to be any restriction left that's started from the pandemic. If there is, I'd be surprised. Quite frankly, I'm getting concerned. We're starting to come near that time where they may say, you're not allowed to wear a mask in a bank again, or any business. Because remember, before the pandemic, if you had a mask on going into a bank or something, you would be arrested. And a lot of crime cases, at least when I watch the news, a lot of crime cases involve someone wearing a mask, such as a COVID mask, and they're citing it as a problem. Look at Eric Adams in New York. He made a statement about a month to a month and a half ago. He doesn't want people to go in a business with a mask on because of the rise in crime. It's utterly ridiculous. Mask should just always stay. I think mask, or high quality mask, not the flimsy cloth or blue surgical mask, but high quality masking needs to stay because it is a vital tool to fight this pandemic. Alrighty, moving on to this, also from CBS News. AstraZeneca says new COVID drug could guard against all variants of concern to date. So, we haven't really seen any new treatments come out. The biggest one that we've seen, and this has gone back quite some time now, is Paxlovid. We just had that recently in COVID history, and Paxlovid was a treatment that came out. It does reduce hospitalizations. However, there is the problem with the rebound cases. Well, it says here a replacement for a key COVID-19 antibody drug that has been used to protect immune-compromised Americans could be available within months. Executives for drug maker AstraZeneca said Thursday after promising early results suggested it may work against all known variants of concern to date. And if you go down here to read more, that does include XBB.1.16, Arcturus. So this is some good news, but if you keep reading, it also says this drug probably wouldn't be available until at least September. Here we are in April, almost into May. September's a long time. And as you know, with coronavirus, there could easily be a new variant between now and then that could undermine this altogether. But for now, let's just go with the good news that there's a potentially new, effective treatment coming down the line. We need to see more tools come available. Alright, now to this. This is Zoe Health Study. For those who don't know, Zoe is basically self-reported test over in the UK, and there is a study where they use this. I have heard rumors this might be ending soon. I don't know if that's true or not. But the point I'm trying to make here is cases in the UK on the Zoe are starting to rise again. For those who have been paying attention for the first 2 years of the pandemic, know that up until the middle of last year, till we started having homegrown variants, we would follow whatever happens in Europe and the UK by 2 to 4 weeks. So right now there is a rise going on in Europe. We'll have to see the next couple 2 to 4 weeks are very key here in the United States to see if we see a rise, because let's face it, this is the longest period of a drop that I think we have seen since dating back to when the vaccine first came out, where we did see a spring wave, but then there was just that huge lull until Delta came around. And I don't recall another time. And you'll see in New York State data, I'm going to show you something today. I'm going to zoom it out further, and you'll see. Last year we were having those constant, you know how it would drop, the bottom would be higher than last and higher than last. No, we're just in a constant drop now. And yes, I get data's less, but it's really impressive. But we have to pay attention, because at any moment's notice, things could change. And here's an indicator right here, at least one of the old indicators that we used to use, and that was Europe starting to rise again. All right, moving on to this day in COVID history. April 28th, 2020. Polls show that many people in the U.S., particularly those ages under 30 or making less than $40,000 per year, plan to defer medical care because of the cost of treatment due to the lack of insurance or being underinsured, potentially leading to further spread of COVID-19, the underreporting of case numbers, and excess deaths, and COVID-19 and other preventable diseases. All right, this brings up a couple good points here. One, case numbers are still underreported because with testing starting to go down the wayside, being by the you do you policies and whatnot, a lot of insurance companies are not paying for tests right now, so you have to pay out of pocket to get a PCR test, which ultimately gets reported to your health department. Number two, it just showcases a problem that's been going on before COVID, and healthcare is way too expensive in this country. We have some people who pay thousands of dollars a month for healthcare. That's ridiculous. I don't think healthcare should be 100% free. Maybe in some cases it should be, but I don't think anybody should be paying more than $100 a month for healthcare. I mean, it's ridiculous to see people paying $1,000 a month for healthcare and still not have adequate coverage. It's just ridiculous. It's a huge problem in this country. It needs to be worked on. I don't know how we would go about getting it done, but something needs to be done, because it's totally ridiculous. It's bothered me before the pandemic even started. Taking a look here at wastewater, you can see here on wastewater, nationally, all 4 regions are still dropping. We did do our wastewater update yesterday. If you did not see that, check it out. It's 2 or 3 videos below this one, and check that out, because not much has changed since we did that update yesterday. We're continuing to watch Ohio, where we see all these moderate to near high sites, and that is our state of concern as of right now. We don't have any other states that are really terribly concerning, but that's the one that we're continuing to watch. CDC transmission, this updated yesterday late in the evening. High transmission, 573 counties. Substantial, 410 counties. Moderate, 1,516 counties. And low transmission is at 624 counties. Out of the 4 categories here, moderate and low transmission saw a decrease, while the number of counties in high and substantial dropped. So that is good news, but the one that we really want to see drop, or rise the most, I should say, is low transmission counties. We want as many low transmission counties as possible. Do not pay attention to Iowa. They stopped reporting altogether. Shame on Iowa for doing that. Here's today's variant proportion, and we did do the variant proportion update region by region. It's our previous video from just a few hours ago. Today's number that's still leading is XBB.1.5 at 68.8%, followed by XBB.1.16 at 11.7%, XBB.1.91 at 9%, XBB.1.92 at 3.7%, XBB at 2.4%, XBB.1.51 at 2.2%, and FD.2 at 1.3%. Taking a look at the BNO numbers, new cases 30,048. The average is 13,510. That's down by 483. States reporting 21 out of 50. In the hospital, 13,795. That's down by 291. In the ICU, 1,802. That's down by 90. New deaths, 367. The average is 162. That's down by 4. So We're continuing to see things drop here. It's just a ticking time bomb at this point. How long until we start to see a rise again? And as I just showed you a little bit ago, there is that rise that is starting in Europe. Will we go back to following Europe again? Only time will tell. Taking a look at New Jersey for today, 162 new confirmed cases, 168 probable cases, 1 lab confirmed death, and 2 hospital reported deaths. Taking a look at the hospital situation in New Jersey, 232 hospitalizations, 8 people on a ventilator. In the ICU, we do have 24 patients in the ICU in New Jersey. Taking a look at Center County, Pennsylvania, the only hospital in Center County, Pennsylvania, which is Mount Nittany Medical Center. Why do we look at this? Because it gives a sense of the urban and rural setting in Pennsylvania. It updates 5 days a week, or in most cases it does, since Pennsylvania only updates 1 time a week, and it gives us a sense of what's going on in both a rural and urban setting. Hospitalizations are starting to rise again. It's up to 6 today. Now, this is not a big rise. We don't get concerned about Center County until they go over 20. But it looks to me as if they're falling into a pattern where it just so happens to go up on the weekends. Last weekend was higher than it was during the weekdays. Taking a look at New York State, 451 new cases in the last 24 hours, 1.4% positivity, 7-day average is 1.4%. Hospitalizations. Today's hospitalizations did drop again to 617, in the ICU 64. Now remember, I was saying I was going to show you something here. This is the lowest number we've seen in the hospital since right around when everyone was getting the vaccine. Well, most people were going out to get vaccinated. And you can see back at that time it was in the 300s. Then the Delta wave came and it really went up. And then if you recall last year, it would rise, then it would drop, but not drop as low as the previous time. Then repeat and repeat and repeat. And then now, look what's happening. It's starting to drop. It's been continuing to drop since the beginning of this year, and it's still dropping, and it's dropped below all of the bottoming of last year. And again, this is the lowest level in New York State since going back to pre-Delta 2021. So this is really impressive. We'll just have to watch and see what happens, because once again, Europe's starting to rise, and I'm concerned we may go back to following Europe again until a homegrown variant pops up again. Let's take a look at some international data. We're not going to go through a lot of countries here. We'll just do some, because we got to get the flu numbers too as well today. South Korea, 6% increase in cases, 48% increase in deaths. Japan, 15% increase in cases, 16% increase in deaths. Russia, 7% decrease in cases, 9% decrease in deaths. Vietnam, 76% increase in cases, just 2 deaths in the last week. Romania, 170% increase in cases, 15% increase in deaths. All right, moving on to the Friday flu update. For the most part, the United States is doing really well on flu. Still moderate levels in New York City, still near moderate in California and near moderate in Mexico. Low in Washington, D.C., and low in the rest of the country. We do have an area of concern. For some reason, Puerto Rico is now at high levels of flu cases. And if you recall, for coronavirus, last year at this time, they had a long duration wave, where it's just a continuous wave of COVID cases. So maybe it's something normal for viruses to spread at this time of the year in Puerto Rico. I'm not certain. I do know there is some sort of a festival that happens annually in Puerto Rico. Has that happened yet? Post down below in the comments section if you know anything about that. But I'm just confused as to why their flu numbers have now reached high levels in a warmer climate. Alrighty, that does it for today's pandemic update. Our next video will be the pandemic update again tomorrow. Don't have anything special for tomorrow morning as of yet. You never know. Could find something. But we're going into a weekend. There's often risky behavior in the weekend. Please, limit that risky behavior. We are doing so well right now in getting the cases down. I know we missed a lot of data, but just please, until I see you again next time, test negative, stay safe. If you like this video, give it a thumbs up. And if you want to see more content like this, subscribe down below. Alright, till next time, stay safe. Have a great weekend, everyone.